If you be a man over 40 and you've noticed subtle changes in your urinary habits, sleep, or pelvic comfort, this is something you shouldn't ignore. Many men quietly assume this is just aging and move on without understanding what's actually happening inside their body. But when urologists look at these patterns over time, they often notice something different. They notice that small daily behaviors, especially movement habits, can quietly influence how the prostate feels and functions. This conversation isn't about fear, embarrassment, or extreme promises. It's about understanding your body in a calm, respectful way. Prostate changes are incredibly common as men age, and talking about them openly is part of responsible health awareness, not something to be ashamed of. This is something urologists and men's health specialists discuss every day in clinical settings. Medical research has consistently shown that circulation, muscle tension, and pelvic pressure all play a role in prostate comfort. While no single movement can reverse aging or guarantee outcomes, certain movement patterns are repeatedly associated with better pelvic health over time. In this video, I'm going to walk you through why urologists often recommend one specific type of movement for prostate health, how it works inside the body, and why it's so often misunderstood. And toward the end, we'll talk about the most overlooked reason this movement helps, even in men who think exercise isn't for them. Many men believe prostate health is only about medication or diet, but movement plays a quiet role that often gets ignored. As men age, especially after 50 and 60, they tend to move less without realizing it. Sitting becomes the default posture. Hours pass in chairs, cars, or couches. Over time, this creates increased pressure in the pelvic region and reduced blood flow to sensitive tissues, including the prostate. Urologists often notice that men with prolonged sitting habits report more urinary discomfort, slower flow, or nighttime disruptions. This isn't because sitting directly damages the prostate, but because reduced movement limits circulation and allows muscle tension to build in the pelvic floor. When muscles stay tense for long periods, nearby organs can become more sensitive. The movement urologists often recommend isn't intense exercise, heavy lifting, or anything extreme. In fact, it's often something much simpler and slower. It focuses on gentle activation and relaxation of the muscles surrounding the pelvis, hips, and lower abdomen. This type of movement supports circulation without adding pressure. A lot of men unknowingly hold tension in their pelvic area throughout the day. Stress, posture, and even subconscious habits can cause muscles to remain slightly contracted. Over time, this constant tension may contribute to discomfort or increased urinary urgency. Gentle, intentional movement helps interrupt that pattern. Here's where many men get confused. Online, you'll see claims that one exercise can shrink the prostate or fix symptoms in days. That's not how the body works. Real prostate support is gradual. It's about creating an environment where inflammation is lower, circulation is improved, and muscles aren't constantly compressed or tense. The movement urologists recommend often involves controlled hip motion, slow walking, stretching, or pelvic awareness exercises. These movements encourage blood flow without strain. They also signal the nervous system to relax, which plays a role in urinary control. Some men avoid movement because they worry it might make symptoms worse. In reality, overly aggressive workouts are more likely to cause discomfort than gentle movement. That's why urologists emphasize moderation and consistency instead of intensity. Another important aspect is breathing. Shallow breathing increases tension throughout the body, including the pelvic floor. Deep, slow breathing combined with gentle movement helps reduce internal pressure. This combination supports comfort more effectively than movement alone. This is where misinformation often makes things worse. Extreme advice online can make men feel like they are refailing if they can keep up. But prostate health isn't about pushing harder. It's about reducing unnecessary strain. If you're dealing with prostate changes, you're not alone. Most men experience some degree of prostate enlargement or sensitivity as they age. This doesn't mean something is wrong with you. It means your body is changing, and understanding those changes gives you more control. Supporting prostate health usually comes down to three things: improving circulation, reducing chronic tension, and minimizing prolonged pressure. The movement urologists recommend touches all three. It encourages blood flow, relaxes surrounding muscles, and breaks long periods of sitting. Men often notice indirect benefits as well. Better movement habits can improve sleep, reduce nighttime bathroom trips, and increase overall comfort during the day. These changes don't happen overnight, but they build gradually. The most overlooked part of this movement is consistency. Many men try something once or twice and then stop, but the prostate responds to patterns, not one-time efforts. Gentle daily movement, even for a few minutes, can have a cumulative effect over months. Another overlooked factor is awareness. Paying attention to how your body feels before and after movement helps you recognize what supports comfort and what increases tension. This awareness alone can change habits throughout the day. Understanding your body is the first step toward feeling better long-term. Prostate health isn't about fighting aging or chasing quick fixes. It's about supporting comfort, dignity, and quality of life as the body evolves. If you want more calm, respectful, and practical information focused on men's health as we age, you'll find it here.